about healing and we talk about deliverance in the church, but I also think that healing and deliverance comes with information and education. I think that when you shine a light in a dark area, people are healed and they're giving a seed is planted for them to do what it is that they need to do with the information. So, for me, when a patient comes in to see me, they recognize within themselves that they are depressed, they are anxious, they're having some racing thoughts, and sometimes even having some suicidal ideations, which are just some suicidal thoughts of not wanting to live, not wanting to be here, or even having a plan of what it is that they're going to do. So when a patient comes in, I introduce myself because I'm gonna do this. The reason why I'm gonna do this is because our people, we do not seek mental health treatment. And we say in the mental health community that is a stigma against mental health and getting treatment. We say, I go to church, I believe in the Lord, I've been praying this away, I know he's going to deliver me, and he very well can. But sometimes he put people in the earth realm to help. Okay? So when you come into my business, we get you set up, we have the paperwork. This is nothing different than you going to the doctor's office for your heart, for your diabetes, for anything else. It's just the same. The brain is just as important. So when you come in, I introduce myself. I say, hey, my name is Felicia Gathings. I'm a psychiatric mental health nurse practitioner. I bring you in, I do your vital signs. No other clinic. What other clinic you know don't do vital signs? I check your blood pressure, I check your heart rate, I check all of that, I check your weight. So when you come in and you see me, I say, what brings you in today? That's not a hard question. What brings you in today? What made you make this appointment? And they begin to tell me, I've been sad, I've been experiencing this for over 2 weeks, I'm not eating, my concentration is off. There's times when I just want to lay in the bed and not even get up. Sometimes I just cry without a reason. And also, there's times when I feel like, and I'm just giving you an example of what patients tell me. I love my family, but sometimes I wish I could just never wake up. And so I say, okay, so how long has this been going on? They tell me the 2 weeks. How often is this happening? Every day. Every day I'm feeling like this. With a diagnosis, and I'm gonna get from behind this podium. With a diagnosis, it has to be going on for a certain period of time. It can't be something that just popped up yesterday and I'm sad. Just like with grief. A lot of times with grief, we're depressed, we're sad that our family member has went on. But if it just happened, we can't really say that you have a depression diagnosis. We can only say you're depressed, but we can't give you a diagnosis for it. So after that, I ask you about your symptoms. I get all of the information that I need. I get your family background, because what we know also is that if my mama was depressed, if her mama was depressed, if my sister's been depressed, if my grandfather was depressed, depression can go down the chute. It can be genetic. So I get your family history. I get your background history. A lot of times with depression, they've been treated for depression in the past, and then they had a moment where they were doing well. So they may be back again because we call that a recurrent episode of depression. After I get all of the symptoms that I need, I give you what your diagnosis is, and then we begin to talk about treatment. What does treatment look like for a depressed patient, an anxiety patient, a bipolar patient, or anybody else? First of all, with depression and anxiety, I usually start a person on an antidepressant. What is an antidepressant? It's a medication that allows chemicals in your brain to increase. So what it does with depression is it improves our mood. It makes us feel better. If you are anxious and I start you on an antidepressant, what happens is it decreases your anxiety. When we come to bipolar, I prescribe something like a mood stabilizer. I'm not going to go into the different, because more than likely y'all probably not know about some of these, so I'm not going to go into them, I'm just going to say mood stabilizer. So if you are manic, that means that you're all over the place. Moving all over the place, talking all over the place, irritable, aggressive. We'll give you something that can calm you down, but we'll also, with that medication, it'll also bring you up. So it balances you out, the mood stabilizer does. But after we talk about medication, I give you the side effects of the medication. I don't give you, just give you the pill and just you leave out there. That ain't how that works. I tell you what the medication does. I tell you what to expect. Some of the side effects are. And then I let you make the decision on how you want to move forward with your treatment. Now, does it mean that you have to take a pill for depression? It doesn't. Because we know that mild depression can be treated with therapy. But we also know that moderate to severe depression is better treated with therapy and medication. And so having that information, I explain it to the patients, that makes them more comfortable with moving forward with treatment. I'm not a pill pusher. But if you are severe enough that you're having suicidal thoughts, you need a pill before you leave out of here, or I'm going to send you to the hospital. What does that look like? If you are severely depressed and you come into my office and you begin with, I want to hurt myself, and I know how I'm going to do it. Okay, give me 1 minute. We're going to move you on, because there's nothing an outpatient clinic can do for a person that's that severely depressed. So you have to push them into a higher level of care. That means inpatient. Inpatient, there are several hospitals around here. We have Baptist, Behavioral Health, and then we have North Mississippi. I used to work at North Mississippi. Matter of fact, I did a lot of my clinical at their inpatient hospital. So there's Tupelo, North Mississippi Behavioral Health, inpatient, but I send you somewhere. You going somewhere. Just to give you an example of what I deal with every day. I had a 12-year-old, and my mom called and said that she's been depressed because her dad hasn't been, she hadn't talked to her dad in months, and so I said, okay. I said, so we set up a telehealth visit, and I didn't realize how severe she was, or I wouldn't have done a telehealth visit. A telehealth visit is a visit that you're not in my office. You're wherever you are, at your house, in your car, wherever you are. We're doing a kind of like a FaceTime call with each other. So she got on the call and she began to cry, and she said, I'm tired. Now, a lot of people would say, a 12-year-old, you tired? What you tired from? But as a mental health professional, we are taught how to respond to those type of answers. So she said, I'm just tired. My mom got remarried. I don't think that my stepdad likes me. He mistreats me. I feel like, she said that, I feel like my mom wants to get rid of me. So she just began to cry. She said, I know how I want to do it. This 12. I'm going to take me some pills. Actually, her friend had just kicked in the door in the bathroom with her trying to take some pills and take an overdose. So I began to talk to the mama, and the mama says, I just feel like this is just for attention. And I let mom talk. And we know that people do that. People do say that I'm going to do something to myself to just get your attention, to make you feel how they feel, or make you mad, or whatever. So I told mom, and me and mom, I'm a very sensitive person. Let me just say that right there. When a 12-year-old tells you that they don't want to live no more, I'm just all over the place. I say, Mom, I don't care if it is for attention. If she do it and she's successful with it, then you don't have a daughter anymore. Right. Like, this is, I get, I'm not gonna go into these games where I get all that. But at the end of the day, I take every person that tells me they don't want to live, I take it very serious. That's right. Because how do we know that the next time won't be the last time? That's right. That's right. This is serious. And so I told the mom that we got her into the hospital in that area that they were in. But I also explained to mom, I need to be seeing her face to face. Telehealth visits are good for people that are stable. But when you're not stable, and I need to see you in front of me because I can pick up on a lot more versus on a teleconference. But I started my 12-year-old on Zoloft, and she began to do better. But she really did better once. This is a child that had homeschooled. She was homeschooled. So once her mom decided to put her in a school, a brick and mortar school, she started to thrive. She started to do better. I've had patients that have tried to commit suicide, and you go in and they may come from ICU, or they may come from it wasn't successful and they end up in the hospital and then they're transferred to me. And you still put them on a safety plan, because how do I know that once I see you home, you're not going to try to do something then as well? Mental health is very serious, you guys. Like, suicide has been on the rise. We've seen it in this community. That was actually my family member. So we've seen it in this community. Kids, I've had so many kids come in and say that they don't want to live anymore. Sometimes it's because of bullying. So if you got a child, talk to your child about if they're being bullied, because these kids ain't telling us what's going on at these schools. So you need to be talking to them, asking them questions when they come home. When that happened here in Aberdeen, I immediately woke my kids up, and we had a conversation, especially my 16-year-old. So I take it very serious. Even if they come home and they say, Mama, somebody bullied me at home, and look, what's the old saying? Well, if they do, you need to take it and not, y'all know what it is. But at the same time, these kids ain't like us. We were ready when we went to school. But these kids here, they don't do that. Their mind frame isn't, they don't want to be violent. We got some that is, but I'm just saying, for the most part, I don't make grew up in the hood. We came out the hood, we put them in a better school, but they ain't as tough as, and I want to be careful with the language, because I don't want anybody to think that we're speaking down, but the Bible even says that, it says, I want to make sure that I word it right. It says that generations become weaker and weaker and wiser.
That's right.
So they know all about this tech stuff. They know about everything else, but they aren't strong enough to handle what we've experienced as what we've been through. And so having conversations with your kids to make sure that they are comfortable coming to you and telling you, and you watching your mouth and saying, okay, this is how I'm going to support you in that. Not, I know you ain't letting nobody do this, that, and the other to you. We gotta respond better. Yes. We gotta respond better. Yes. And we have to be able to take in consideration what it is that they're telling us and then move forward. They want to see us support them and go to the teacher and talk to the teacher and talk to the parent of the child that's doing the bullying and see what's going on. Because bullying is one of the ones that is causing these kids to leave school and hurt themselves. And then this love that they have for relationships. And they love this boy and they love this girl. And then a breakup happens.
Oh, yes.
And my boyfriend left me, you 14.
Mm-hmm.
But learn and teaching them, this is another thing, and this is good in therapy. Building up your esteem and learning how to love yourself.
That's right. That's right.
Having real conversations with these girls and boys that another person can't make you happy. Another person can't bring you joy. You have to learn how to make yourself happy. You have to learn how to bring yourself joy. Because when you put all that dependence in another person, they have that much control over you. What's going to happen? You're going to lose control when they say, I'm out.
That's it.
But being strong enough to say, okay, you don't want to be with me no more, breathe the relationship normally, and walking out and being okay with the person walking away. That's healthy. Because let me tell you something, sadness is not a bad thing. Anger is not a bad thing. They are normal emotions. When somebody tick us off, we're going to be irritated. But with mental illness, when you irritated and ain't nobody did nothing to you, that's an issue. When you angry and you're able to do something, physically hurt somebody, that's not normal. You supposed to have control over your emotions. You allow your emotions to be there and you allow yourself to feel whatever it is that's happening. But you gain control over that so that you won't, or your reaction won't be detrimental. So I explain to my kids, I tell them all the time, you didn't go to school to love nobody. You didn't go to school to do that. You went to school to get your lesson. Having a boyfriend, having a girlfriend, that's cool. But learning how that sometimes those relationships, once you go to college, you don't even see these people no more, just to be honest. And so after I may do a little counseling session like how I just dove off into something different. I may do that with them, especially whatever it is that they came in with. After that, I may give them their medicine. I prescribe them their medicine, send it to the pharmacy, and I set them up another appointment. And then they'll come back in 2 to 4 weeks so we can see how the medication and how they're reacting to the medication. There is something else that I do. Patients that have been on antidepressants, been on several antidepressants, there is this thing, it's called a genetic testing. I'll swab your mouth and I'll send it off to labs, and it shows like what your DNA do best with when it comes to medications. And so there's a lot of times when patients have been on Prozac, Paxil, Zoloft, all these antidepressants, and they're like, I just can't take that. That made me do this, that, and another, and I do the DNA swab. And it shows that they just wouldn't have done well with those medications anyway. And so I end up putting them on the medication that it shows that they would do well on. I give them the option, like if something happens with their medicine, I tell them to call me. If they have a problem about anything, we'll talk about it, we'll fix it, and then we'll send them back out. If they have any questions, they can always ask, they can always call. Do you guys have any questions today about anything that I said?
I hope you brought some cards.
I did.
Okay, you want to pass out your cards. Because even if no one has questions and don't want to say anything, whether it's for a friend or a loved one, they know how to get in touch with you.
Yeah.
I have a question. Being 14 years old, how long do you let them stay on their pill, on their depression?
So when it comes to medication, if a person comes in depressed, research shows that if I start you on an antidepressant, usually an antidepressant, it takes about 4 to 6 weeks for you to know how effective it can be. That means how it can work in your body, how good it can work. And so with it being 4 to 6 weeks, that's already a month and a half. 6 months to a year for a first-time depressed person on a medication and therapy. If you do well on that, I'm willing to taper you off of it slowly, and I'll send you out. If you've been diagnosed with depression before, and this is a recurrent episode, sometimes, and I'll give you a number, and I'll throw this number out, 75 to 80% of the time, you may end up being on medication for a long time. It depends on what you're willing to do. That means, are you in therapy? Are you changing the behaviors that you have came in with that we've told you and shown you that aren't positive behaviors? A lot of the stuff that we were taught as a child aren't positive coping skills with what's going on in the world. So learning new things and unlearning things that can lead us in a depressed state.
I know of a couple of principals we had in our school district. In their adulthood, as they were principals of school, they had to take medication because we didn't want them to get out of control, and they didn't want to get out of control. In order to maintain their job, they had to take medication.
And so that's called being under stress. And a lot of times, even if you're under stress, I would say, now before I start you on some medicine, just because you came in here with some stress, more than likely I'll send you to therapy first. But it depends on how long you've been under that stress. We also diagnose that with an adjustment disorder. So that would be Whatever it is, whatever stressor it is, it's causing you to be depressed, or it's causing you to be anxious, or it's causing you to have a mixed diagnosis. We do prescribe medicine for that. Sometimes if it's really severe, they can't, like, they having trouble going into the classroom and all that kind of stuff. But you won't have a major depressive disorder until you've been diagnosed with that for some time. Maybe got adjusted with it, maybe never did, and then you'll go over into a major depressive disorder.
How about insurance? How does that work? Because I know most of the time if you got Medicare and Medicaid, you have to have a referral. Whereas if you have private insurance, you can make your own appointment. How does that work?
So with my clinic, and currently, like right now, I don't take Medicaid, I do take Medicare. And Medicare, you know, that depends on what the facility that you're trying to refer to. Isn't that correct? Because I don't require a referral for patients to see me. If you feel the need to see me, I'm fine with that. But most of the patients that have shown up in my office were referred by, say for instance, like a family, a nurse practitioner, or a doctor, or just like urgent care, those type of places. They were the ones that referred patients to me. But it depends on the receiving. Whoever is receiving, whatever they want to do. I think behavioral health, you have to have a referral, but like you don't necessarily have to have a referral for a mental health. Some specialties you do.
Do you, treat family members?
No, I do not.
If someone walking around, they saying that they have different personalities, and some people say it's a guardian angel. So would you say that is a type of mental illness or what?
Say that one more time.
If a person is walking around, they say they have multiple personalities, but some people call them guardian angels. So would you say that's a mental issue?
So, with me, I try to be careful with a lot of stuff or whatever, because, you know, at the end of the day, I'm gonna say it like this, I'm a very spiritual person, so I'm kind of in tune with a lot of things that happens. So I try to be careful when I distinguish between a person that is hearing from God, a person that is moved spiritually by angels or whatever it is. I try to know what it is or what it is they're trying to explain to me. And I allow people to have their spirituality. Like, I don't try to, you know, I don't introduce God until they say God. When they say God, I may say something about God. But if you come in and you don't say anything about him, I still just let him leave me. He would also leave me and let me know that this ain't right. So, if it is a real multiple personality and they're saying it like that, then that's not normal. Because personalities are the things we've experienced in life, the things that, just life period is our personality, what type of person we are. I'm the type of person that sometimes, a person that want to talk all the time. Then it's times I shut down and I don't even want to deal with nobody. So that's a personality. But when you got multiple personalities, and I'm going to give you an example of, a lot of personality issues come from trauma. When a person has experienced trauma in their childhood, that was pretty much what my doctorate was. But when you've experienced trauma in your childhood, we would change personalities to fit what it is that is going on in and out. So let's just say, for instance, like you at work and you having a conflict with somebody at work. And it reminds you of a conflict that you had with your parent who was abusive to you. You may shut down and become like a little child and talk in a little bitty voice. Yes, ma'am. No, ma'am. You'll put your head down. You'll become small. You don't want to be seen like a little child when you say, if you don't go sit down. And they be like, that's a personality that you were never healed in childhood. There's also other personalities that come up when someone says something ugly to us, and then you rise up like a monster, and you ready to shut this whole place down. That's a personality too, because you've never healed. But I think what you're saying is a person that is hearing and being led by this, that, and the other or whatever, that can be something that goes in the box of their spirituality, and I leave that alone. Unless I feel like that's something that that ain't God right there. That may be a little demonic. And then, you know, I put my oil on in the morning time, so, you know, I don't need to take none of these spirits home with me. But it can go left. So, I think that's what you're referring to. I'm glad I got strict because I keep on looking over here. Me and her worked together in community counseling from 2013 to 2017, I think, when she went on to be a county administrator, child. But at the end of the day, she got that counseling piece, and I'm gonna look over to her as well. I hope I answered your question.
I got one question, man. Just say a person, I come to your house, and I come to your house and I say everything in the word to you, and out of the way, name call or whatsoever, you know, and maybe come back the next day, everything is just fine. What kind of person, what kind of people are there?
So what you're going into is, you know, we always try to give people a bipolar diagnosis that just because they cut up and they did that one day, and then they come back in, and then they're good. But a lot of times that's not bipolar. Okay? Bipolar is, I don't diagnose bipolar unless I see you manic. That means your energy is high. That means you're easily distracted, like you looking all over. You may come in here with a flower dress with some red, one eyeshadow pink, one eyeshadow blue. Your hair may be in a different, but you're fine. You know what I'm saying? You may have racing thoughts. A lot of times bipolar may come in that you're angry, that you're irritable, but it went over a period of time. And it has to be that it's not one day, but it is, they've been like this several days, cutting up, acting a fool for days. More than likely, they're in a manic episode, or in your case, what you're referring to is a person that was never taught how to communicate. So a lot of times, where does our anger come from? Not being heard. A person don't understand us. And when we're not able to effectively tell you how we are feeling, say for instance, like last week I tried to come over there and talk to you and tell you something or whatever, and you shut me down, and then I left and I went home and I stirred it. Let me tell you, you're gonna stir it. You come back again or whatever, you try to talk to a person, and they shut you down again, and then you stir it. The next time I may come back and I may cut up, because you're not trying to hear me. But see, there's communication such as passive aggressive, when you let people say whatever they want to say, but you may be mumbling on your breath. They say, I'm gonna cut up on you, whatever. They say it one more time. I ain't even gonna say that. That's why I hear they coffee move. I hear they coffee move. They ain't gonna be able to get it tomorrow, whatever. That's passive aggressive. Aggressive is you say something or whatever, and you ready to fight. Somebody hold me back, because I'm about to this. That's aggressive. You tear all this up. That's aggressive. Punch a hole in the wall. That's aggressive. And a psychiatrist once told me this right here. He says he hates when people say that there's three lines. He said really and truly it's two, and the way that you're supposed to go. So you have passive aggressive, you have aggressive, and then you have assertiveness. And if they even try to cut you off, you say, because you're going to hear me today. That's assertiveness. Setting boundaries, letting folks know that I had to do this with her. Look, don't be calling me back to back like that right there. I don't like that. That's my mom. She will call, 2 minutes pass by, she call again. 3 minutes pass by, she call again. She'll give you time to call her back. She called, am I lying? Yeah, and so it's like, calm down, I'm gonna call you when I get sick. I got 3 kids. And also when I get out of work, I be wanting my time to just de-stress. But she don't know how to do that right there. She gonna call you 50 times. setting boundaries with people and letting them know when they are making you uncomfortable. That's assertive communication, okay?
Well, let me ask you something, I ask you nothing
Now
else.
you can answer whatever you want to.
Let me, how do you deal with, with people like that?
So it just depends on if this is, again, a person that just don't know how to communicate. There's therapy for everything, guys. Therapy for communication. There's therapy for your thoughts, cognitive behavior, teaching you how to change your negative thoughts to positive thoughts. There's a therapy where they just let you talking therapy. Just you need somebody to talk to. They're not gonna be judgmental. They're not gonna be biased. They're not gonna be worried about you telling somebody else. Just need somebody to talk to. There's therapy for that. Having a good therapist to teach you how to communicate and to lead you in communication is how you deal with that. Unless this is a pattern and it happens during an episode. A lot of bipolar patients sometimes are very irritable. They are very aggressive at times, especially if they haven't been on their medication. So it just depends on if they have a diagnosis or just need some intervention and not specifically medication. I don't do therapy. I share an office with, it's her own business. She does the therapy piece. She only takes Blue Cross Blue Shield. She is very good, especially, and I think we work so well together because we're both passionate about trauma. And so she does the therapy piece. So if a person comes in and they say, well, I'm not ready to take any medicine, and if I could get them on her schedule, I do. If they have some insurance other than what she takes, then I find a therapist in the area for them. If their therapist tell them we don't get nowhere unless you want some medicine, then they'll come back to me. For my business, I take Blue Cross Blue Shield, I take Medicare, I take Cigna, and I take Ambetter. Currently being processed with United Healthcare or United Behavioral Healthcare, and also being processed with TRICARE. Those are the insurances that I currently take. Any other questions?
Yes, how do you deal with the more deep-rooted issues in your life, like you talking about the trauma from when you were younger, when those scars are still there into your adulthood? How do you know?
So, let me say this, I'm gonna give you your answer. So, when I did my research for my doctorate, my thing was called adverse childhood experiences. And what that research taught me as I began to search the literature, it taught me that when we don't get the healing that we need from the things that we've experienced in our childhood, it shows up as a diagnosis, such as if you've never had someone to take you and help you deal with some of the things that you was experiencing, such as your child went to jail, or your parents went to jail when you were a child, or your parents were on drugs, or you were abused, sexually abused, or whatever type of abuse. If you
Giving up for foster care.
giving up for that's neglect.
Yes.
So if you had some of those things in childhood and they were never dealt with the proper treatment, what we've learned is that it shows up in adulthood as depression, anxiety, even bipolar, high blood pressure, diabetes, high-risk behaviors such as girls being molested, that person never being called out for their wrongdoing, and the family covered it up. I'm keeping it real because there's a lot that happens in our community. Uncle Lester was touching on baby girl, and everybody knew that Uncle Lester was touching on baby girl, and they covered it up, and they said, baby girl, you're gonna be all right, and baby girl is still coming around Uncle Lester every Sunday on Sunday dinner. Not fair to her. Not fair to her at all. So there's a lot of people that don't feel protected. And so they walk around with all of this anxiety just built up in them. And a lot of times when you become an adulthood, it comes to a head because it was never treated as a child. And so high-risk behaviors could be for her that, well, if my family never did anything about it, she can become a person that has multiple partners, expose herself to STDs, get into abusive relationships because no one ever told her that that actually was wrong and other levels need to be under the jail. Drugs to numb the pain, alcohol, drinking, because they never was taught how to deal with it. A boy may be, let's say, he being abused by daddy. Every time daddy come home, he have him a beer and he knocking him out. So he may run to the streets. That means that he may get in a gang. He may start carrying a gun at the age of 13, 14. He may become abusive in a relationship. That's another thing. Hurt people hurt people. I know we've heard that saying. And so when it comes to, let's go back to about hypertension, anxiety, it can cause heart problems. It can cause issues like that. Depression. People think that, oh, you need to get over that. That happened years ago. Our body never forgets traumas. It's embedded in us. It's embedded in us. A psychiatrist once told me, I was telling her about some of the things that I experienced as a young woman and being in a relationship with somebody that tried to take my life. And one of the things she said, I said, you know, I often wonder why I never had PTSD. And she told me these words right here. She said, the reason you never had PTSD is because you didn't dwell on what it was that happened to you. You just kept going. Every time something happened, you just kept going. You never stayed still. And anybody that know me, folks say all the time, that girl stay in school. Folks say that all the time. But I never stayed in that place because that place was a place that I never wanted to be in the first place. And I think for me as a child, I remember 9, 10 years old, my mom can tell you this, I've always wanted to be a doctor. She'll tell you, I always said that. And I was almost let somebody take that away from me. And so when you get your power back, it's nothing like it. Because you refuse to let anybody take you there again. And so making sure, wholly, we always talk about the heart doctor, talk about diabetes, but mental health is just as important. It's just as important you taking your blood pressure pill or your sugar pill. Because sometimes we may have to take our antidepressant.
I have a question.
Mm-hmm.
Okay, so I've worked with children probably for 30 plus years.
We know that.
And it's different when your own child. You know, I've been working with all these other children, but now I'm a grandmother. And I'm seeing some patterns in my grandson. And it's to the point where it's almost, I guess I can say embarrassing.
Mm-hmm.
And then I'm feeling like shame, and then look like I get upset when somebody else start trying to diagnose him.
Mm-hmm.
Is that a mental something going on with me, or
No.
is this just,
It's saying, so you were never expecting that to happen. And a lot of the children that I'm seeing now, you know, I try to be careful with ADHD. And even with the diagnosis of autism, like you have to make sure that what you're speaking, and I'm big on this, the tongue powerful. And you have to be careful of who and what you let speak over your kids. ADHD is one of those drugs, not one of those drugs, one of those diagnoses. Let me just explain this to you, because, you know, a teacher came to me about my child, and the way he came to me, I was offended. But I worked at community counseling, I seen the diagnosis, but I wasn't where I am now with it. ADHD is a performance diagnosis. It's not that they don't know. It's not that they're not educated enough. It's they can't put it into place because of the performance part of it. Can I motivate myself to do it? Can I sit down long enough to do it? Can I focus on it when my mind is all over the place? It's a performance. It's a doing issue. It ain't no knowledge issue. And a lot of times teachers not understanding that, they try to make you feel like something wrong with your child. And it's not that something is wrong with them. It's just that they have a performance issue. They learn just as well as anybody else. It's putting it in place. It's implementing it. And I try to be careful, like a lot of times even with my own kids, I don't tell them teachers nothing because what you're not going to do is be speaking that foolery over my kids. A teacher called me and told me that my 10-year-old is lazy. Now anybody know my child will flip all over the church. He'll do all kinds. Lazy ain't a part of him. Hyper, it is. And so when you know your kids and you know what you are instilling in them, you know what you're speaking over them, you have to protect them. Medicine is not for everybody. Medicine is for that severe ADHD where their grades are being affected. They can't sit down long enough in the classroom. They're gonna need something. And the reason why I say that they're gonna need something because a lot of times when we don't treat it, is when they have grown-up issues. Undiagnosed and untreated ADHD in childhood can result in adulthood issues, problems. Not knowing how to talk to somebody, not knowing how to sit down when you're in a meeting at work. Those type of issues will come into play. Or you not being successful in high school, which can keep you from going to the colleges that you really, really wanted to go because of your grades. So it's a performance issue. I don't know exactly what you're saying that your grandchild does. I'm just giving you a childhood diagnosis that is one of the things that I see with a lot of children. And I've already talked about depression and anxiety, so if that was the case, you would have said something during that time. Asperger's, having a social issue, not being able to stand loud noises, socially awkward, if someone comes close to them, like they become rigid, they're anxious as well, not being able to communicate. A lot of them have communication problems. So that's another childhood disorder that you see.
We're gonna stop the question right now, we got to swap.
Okay.
And she's gonna go in the back, and then we're gonna have Mr. Jeffries come out here. If you can give us a quick song while we swap it out, please. Just something short.
What do you want to do this information right
I can pass out your cards.
It's cards in the box, and then that's me and the therapist there, we work together.
Okay, all right, thank you. I'm gonna put this bar. You do the cards and I do these.